Welcome to today's press briefing. We have two speakers of the day, Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager of Hospital Authority with us. Dr. Zhang will first report on today's cases. Good afternoon. As of last night, we recorded 7,528 PCR positive cases and 9,069 rapid antigen test positive cases. The total now stands at 16,597. Cumulatively, including PCR and RAT positive cases, we've recorded 1.02091 million cases. In the fifth wave, we have 670,573 PCR positive cases and 334 cases. Now, for the 7,528 PCR positive cases, 1,217 cases were returned by HA, 1,167 cases were reported by the CHP's Public Health Laboratory Service, and also some 5,090 cases reported by private laboratories. Now, for cases detected by the CHP's Public Health Laboratory Service, we conducted whole genome sequencing, and no case was found to be L452R positive. For 1,338 cases, they are L452R negative. That means the majority of them are suspected to be Omicron cases. And for 185 cases, they're either in pending status or they have low viral load. There are 14 imported cases, 11 of which are passengers arriving in Hong Kong via CX796 from Indonesia on the 18th of March. 3 other cases arrived earlier in Hong Kong, 2 from Indonesia and 1 from Italy. For death cases, the Hospital Authority reported some 243 cases of patients passing away, including 182 cases which passed away on the 18th of March, and also 6 other cases, 61 cases of deaths reported earlier. Altogether, we've recorded 5,410 death cases. For non-HA death cases, there are 2 additional cases. So altogether, there are 27 death cases outside of the HA system, and the total now stands at 5,437. That's the cumulative death cases recorded in the 5th wave. For the 6 cases of deaths returned by forensic pathologists, they include 3 males, 3 females, aged between 67 and 97, all having chronic illnesses requiring special care. They're either wheelchair-bound or bed-bound. For 2 cases, the patients passed away on the 8th, and 4 other cases passed away on the 9th of March. 4 cases were RAT positive, and the tests were carried out at the time of autopsy, and for the other cases, the tests were carried out earlier. For the 5,473 cases, they include 2,127 females and 3,304 males, aged between 11 months and 112. About 58% of these cases involve residents in residential care homes. About 10% of them received 2 jabs, and the others being unvaccinated cases. 88% of them had chronic illnesses. The fatality rate now stands at about 0.5%. For those having received 2 jabs, the fatality rate is lower. It stands at 0.09%, and for those not receiving 2 jabs, the fatality rate is 1.34%, over 10-fold difference. For the death cases, 95.6% of these cases were patients above the age of 70, and 70% of them about 70 years old. Now, for those above 60 years old, if they're vaccinated, the fatality rate was 0.4%. For those unvaccinated, 4%. That means a 10 times difference. Now, in terms of residential care homes, as of yesterday, we recorded 5 additional reports, including 1 from a residential care home for the disabled and 4 from residential care home for the elderly, involving 12 residents and 11 staff members. In the past 2 weeks, 270 residential care homes were affected, involving 89 RCHDs and 86 RCHEs, affecting 6,925 residents and 1,764 staff members. That concludes my report. Oh, I'd like to make an announcement. Sorry. We understand that some members of the public are using the declaration for patients who are RAT positive, and for using this online platform, if you use certain mobile phones, there are technical glitches when you try to download the isolation order. The technical issue has now been overcome. We've made enhancements, and if you're unable to download the isolation or quarantine order before, you can now try again. That concludes my report today. Dr. Lau will now report on the HA's cases. As of now, we have 10,624 cases receiving treatment at public hospitals: North Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority Infectious Disease Center, and AWE's Community Treatment Facility. 63 patients were reported to be in critical condition, 119 in serious condition last night. Now in the ICU unit, there are 119 patients in critical condition. As of midnight tonight, over the past 24 hours, 182 COVID-positive patients passed away, and they were 103 males and 79 females, aged between 30 to 109. Now, in relation to death cases, 99 of these patients were care home residents. 127 did not have any vaccination record. 32 patients had 1 jab, 20 had 2 jabs, and 3 had 3 jabs. Elderly people above the age of 65, 171 of them passed away. I'd like to also highlight some of the younger patients' cases. The first one is a 30-year-old patient who suffered from a G6PD deficiency and a mental disorder, and the patient resided in a private care home or hostel. The patient was admitted to Kowloon Hospital earlier, and there was also kidney impairment. The patient was then transferred to Queen Elizabeth Hospital and then sent to ICU. This patient was young, and the condition deteriorated quite rapidly. So the case has now been referred to the coroner's court to determine the cause of death. The next patient was a 58-year-old patient with late-stage cancer and metastasis to other organs.
He was hospitalized because of bacteria found in blood. That's got nothing to do with COVID, but when admitted, he was confirmed. Another one is a hepatitis B virus carrier, male, 58, and also hypertension problem. And his blood cell counts, including platelet, white cell, are all low, and he was also a chronic patient. Another one is a 58-year-old patient. He had a number of problems, including kidney problems, and thyroid problems, and also the stroke. And he had stroke. He was admitted at the end of February because of stroke. He was sent to the A&E because of stroke, and then on admission, he was found to be positive with COVID. Another one, the last one, is a male patient, 59 years old. He had a lymphatic cancer. He had received various treatments, but the outcome was not very good. He was suffering from low immunity, and the blood oxygen level was also low. And unfortunately, he passed away yesterday. And I would like to report 61 cases who passed away in public hospitals from the 11th to the 17th of March. 43 males and 15 females, aged between 51 to 99. 1,184 patients have been discharged. And we have also discovered that 18 patients were positive with COVID-19 on admission. And also 30 have now been classified as close contacts. On the staff side, we have 19,223 staff confirmed cases, of which 277 have now recovered and resumed duty. We now have the Q&A session. Please tell us which organization you represent before you raise your questions. I'm from Commercial Radio, doctors. I have 2 questions. First of all, the vaccination arrangement for confirmed cases. According to official website, if a recovered patient has not received any jab, then they can, or has received a Sinovac vaccine, then they can get another jab 3 months after recovery. But according to Sinovac official website, asymptomatic patients are not recommended to receive further jabs. But this is inconsistent with what the government has offered. And also Professor Ivan Hong said that the peak of the 5th wave is now beyond us, but half of the population have been confirmed. So we do have the necessary conditions to relax the social distancing measures. And it has also been suggested by some recovered patients that they now can have more social activities because they are not unlikely to get infected again. We know that the vaccination proposal for those who have recovered from a previous infection is the result of the discussion with our experts and our advisory committees, having taken into account the proposals made in other countries. And that is after recovery, another jab can be taken in 3 months' time if there was no previous vaccination. We understand that there are other experts proposing other arrangements, and they have certain projections, and I believe the government will monitor all these in making suitable arrangements. Good afternoon. I'm from Now TV. Some experts have proposed that for the oral medicines, the minimum age should be lowered to 65. And some elderly people have been given 1 jab, but they are not allowed to take the oral medicine. is there something contradictory here? Would you relax the rules in this regard? And it's been announced that if you go to the mainland through land boundary control points, then you need to produce a negative PCR certificate taken within 48 hours. But then they have to take another test upon entry. Why is it necessary? And they said that of the 120 death cases, only 40% cases had COVID. Can you tell us the ratio of death cases who were diagnosed to have COVID at the time of death? First of all, what you say about an additional RAT test, which is free of charge upon leaving Hong Kong, but that is a measure to prevent spreading COVID cases to the mainland, and also in an attempt to collaborate with the mainland authorities in fighting the epidemic. We have two drugs for treatment, molnupiravir and Paxlovid. For the former by MSD, we have given 8,500 patients 1,000 such drugs. As for the Pfizer's drug, it has been prescribed to 400 to 500 patients. So far, more than 1,000 have been prescribed this drug. And our pharmacists, our healthcare experts would set up some clinical instructions on the use, on prescribing the two drugs, including the indications and the possible side effects. Our frontline healthcare officers would make the suitable arrangement having regard to the experts' guidelines on the use of such drugs. That said, although we have guidelines for our staff, they would have regard to clinical factors such as the age of the patient. Some HA experts are discussing whether the clinical guidelines should be revised, or if warranted, how to revise. We would look at the scientific data, and also we would revise the guidelines as we prescribe the drugs to more and more patients. The purpose is to administer the most suitable drug to the patients to reduce the risk of serious cases as well as death. So if you go to a doctor, you should tell your medical history and the drugs that you have been using, and inform the doctors, so that the doctor can pay attention to the latest scientific data and make the best decision for you.
Sorry, I don't remember your question. Death cases, whether it's die of COVID or die with COVID. Professor Hui said that according to the 112 cases analyzed, the ratio of patients dying of COVID and dying with COVID account for 40% respectively. Do you think it is high? What about the remaining 20%? Can you tell us which category they fall into? I don't have information at hand. I also sat in some of these meetings. I understand that there are three types. The first type is that according to clinical judgment, patients had died of COVID. Let me give you an example. Let's say if I'm in good condition and then all of a sudden I fall ill, and then I also have GGO in my lung X-ray examination, and then I pass away, then apparently this patient could be dying of COVID. The other category is that perhaps the death has no correlation with COVID, only that the COVID virus was found to be carried by this patient at the time of death. Just like a few days ago, there was a patient falling from height, and this patient died and also tested positive. Another type is that at the time of a patient arriving at hospital, there was intracerebral hemorrhage. The patient was suffering from stroke, and then this patient had no symptoms, but at the time of admission in hospital. I'm not the expert, but I think that we will take into account different factors. For example, the lab testing result, the X-ray examination, his condition, and the response to drugs prescribed, in order to rule out whether he is or is not of the category. And thirdly, there are also marginal cases that could be. This could be a COVID-related case or not. And I believe experts will get further information to check the patient's record and other reports, such as the autopsy report, such as any reports produced by the coroner's court. So it will take a longer time before these reports are ready so that we can review these cases. And after all, it could be the case that some patients did not, we could not categorically be sure of the patient's category. Some may have correlation, some may not, and some may be marginal cases. Next question. I'm from Phoenix. Good afternoon. For a few days, the number of confirmed cases, be it PCR or RAT positive cases in Hong Kong, have continued to decline. Can we say that the fifth wave of the epidemic is now under control? Will you be able to continue to keep the trend down? And how many private hospitals are now provided with oral medication to treat COVID-19? Do you know the prescription rate? And according to media reports, there are many private doctors refusing to sign a certificate of recovery for recovered patients. Even if they're willing to sign the certificate may cost $1,000. Will the government provide guidelines, and can the certificate be issued to the recovered patients at the time of issuing the isolation order? The figure today stands at 16,000, but of course we should continue to monitor the situation, and of course we hope the figure will continue to at least maintain at a stable level or even decline. As for the certificate of recovery, I understand that if this patient is a confirmed case with an isolation order, the patient can produce the isolation order to show proof. In fact, I understand on our online platform there are forms available for doctors to fill in stating the exemption period applicable. In relation to drugs given to private hospitals or on loan to private hospitals, we do have this mechanism. COVID oral medication is just part of this mechanism. As a standing practice, through this mechanism, private hospitals can get drugs from HA on loan. We take into account different factors, for example, whether there is an avenue for private hospital to procure the drug themselves. And if there is no such avenue, then they can borrow the drugs from us under this mechanism, and whether they have actual patients requiring this medication, and also our inventory level, whether we have a sufficient supply to lend the drugs to them. So we consider the basket of factors. I understand that negotiations are underway, And I think within a short period of time, the private hospitals and the hospital authority will come up with a mechanism on prescription of oral medication. Next question. I'm from Hong Kong 01. First question on vaccination. All along, it's claimed that we have high vaccination rate, generally speaking, except for elderly population. Now, the Secretary for Civil Service, Mr. Patrick Nip, commented that we also reach a target for elderly population, 52%, that is, and that for those living in care homes, only 10% of elderly residents are unvaccinated because of objection from family members. Does it mean that 90% of the care home residents have now been vaccinated? What would you say should be the target of vaccination rate? And would you also have another target group for boosting the vaccination rate? And a question for HA. There was a case of switching identities between two patients in Pok Ai Hospital, and the case wasn't identified until relatives visited the patients. Does it happen a lot? Is it a blunder? Because often family members could not locate the patients in HA hospitals. Now, if this kind of switching occurs, is there a hazard for a patient to take the wrong prescription? And on the supply of oral medication, can you tell us the supply level? You mentioned 1,000 prescriptions made out in the past day. Can you tell us whether the supply is sufficient to meet the demand and whether you have priority for prescribing drugs? I understand for care homes, they've completed the first round of vaccination, and a second vaccine rollout will take place. And of course, residents should receive at least 2 jabs to get adequate protection. Apart from residential care homes, we should also appeal to children and elderly people to get vaccinated as soon as possible. Regarding the 2 patients in Pok Ai Hospital, one age 81, the other age 103, both females. Their identities got mixed up, and the hospital authority has launched an investigation. The preliminary investigation showed that the patients wore the wristband of each other, bearing the identity of the other. And basically, the treatment procedure for the patient would be decided clinically by doctors during the round. That means the doctor visiting the patient would be checking the patient's record and the patient's clinical condition. So this incident has no impact on the patient's health condition or the treatment given to the patient. The Pok Ai Hospital is very concerned, and we've also contacted the family of these 2 patients to apologize and explain the incident. And we've reminded staff members to check the identity of patients very carefully. We will conduct an investigation thoroughly. And we also have a sentinel reporting system, and we've reported the incident. The hospital has reported the incident to the headquarters. As for oral medication, as I explained before, we consider the patient's need, the clinical condition, and the guidelines in prescribing oral drugs. We don't give priority on any other basis. Basically, it's about whether the patient is suitable for the drug. And it's up to the doctor during the consultation to make a clinical judgment. I don't have statistics at hand, but then we've told our doctors that if deemed suitable, oral medication should be prescribed to our patients in order to reduce severe cases and even deaths.
Good afternoon. I'm from Cable TV. In recent days, we have seen the declining numbers of confirmed cases is now fewer than 20,000. Is that there was a death case involving a patient with a G6PD deficiency? He was a 30-year-old. Did that patient take any Chinese medicine before his death? And also, you are going to give out essential packs. Are you going to discover more cryptic cases out of that? Well, I hope the number of cases can reflect the real situation, because some people who are not who are asymptomatic might not have taken the test, so we don't know how many there are. For the 30-year-old patient who died, we do not know the actual cause of death because the deterioration took place in just a few days. We have referred the case to the coroner's court to find out the real cause of death. Good afternoon, I'm from Ming Pao. I want to ask about the cases involving the patients who passed away after they were found found fainted. Did they go to any designated clinic? Did they report any discomfort or illness to CHP? Isolation care monitoring system? And all things starting from next Monday, those who have received 2 jabs can get a 3rd one after 3 months. How many people would be eligible in this category? I have only 3 cases with me, 3 patients, 3 male patients passed away, unfortunately, after admission to hospital. One, a QMH, 87-year-old man. He was taken on board an ambulance on 0053 hours. He was discovered by family members who have fainted after vomiting blood. Resuscitation was immediately carried out by the ambulance. He was found to be dead on arrival, and the time was 1:05 a.m. Because of the circumstances surrounding his death, the case has been referred to the coroner's desk. On the 11th of March, he was tested positive. He went to a designated clinic. We prescribed Paxlovid for 5 days, and he was suffering from COPD, and there was no vaccination record for him. Another one is a male patient, 96-year-old. He was sent to the Eastern National Hospital. He was found to have passed away on arrival. The time was 6:07 a.m. Again, this case has been referred to the coroner's court. The patient had chronic diseases. According to the record, on the 6th of March, he was tested positive to RAT, and there was no vaccination record for him. Another case is a 94-year-old male patient. He fainted at home and was found by family members. Ambulance was called. There was no pulse or breathing at the time of arrival of the ambulancement. He was sent to Rattanji Hospital and was found dead on arrival at 1:15 a.m. He was tested through RAT test positive on the 12th of March. He was suffering from Parkinson's disease, and there was no vaccination record. So when somebody has been tested positive either through PCR or RAT, then the case can be reported through our platform. For those who are living in the community, we would send an SMS message. After logging in, then the person can submit personal particulars and identification information, and report. Also, he can report his symptoms, and according to the level of discomfort and or symptoms, we would offer different types of support. such as patients SMP center, patient support center, support call center with particularly pay particular attention to those under 5 and those are over 70 or who are pregnant. And if necessary, we also make appointments on their behalf to attend designated clinics so that their cases can be properly followed up. According to my colleagues, sometimes when the patient support the call center called them, that they may not take the call. They may find the incoming number unfamiliar. So may I make an appeal here? If you feel uncomfortable, you should get an appointment from the designated clinic and see a doctor immediately. If you have certain symptoms such as persistent fever of more than 2 days, and then despite taking fever-reducing medicine, the temperature does not come down, or you have shortness of breath, or chest pain, or abdomen pain, you should go to the A&E department immediately, because the conditions can deteriorate very fast. And I would also like to appeal to patients that they should, of course, make use of the services that we offer. Attention should be paid by their family members, such as taking the patient's temperature or blood pressure. And if necessary, perhaps neighbors can help them to see whether they need any help. If necessary, they can also call our patient support center or 1-836-115 to get some advice, and or perhaps arrangement can be made for remote service to the patient. And doing these will certainly help patients who are still living in the community. Since we are identifying confirmed cases through our online platform, so it's important that your telephone number is provided, and if necessary, you should take our calls, or you should pay attention to the SMS message. If elderly people find it difficult to use such services, young family members should help them. The speaker is off mic. I don't have specific statistics and data here.
Dr. Zhang and Dr. Lau. So I would like to ask, given today's infection number is 3-week low, does Dr. Zhang has any advice or warnings to the residents, given the number has been coming down? Yeah, thank you.
We have observed a slow decrease in number in recent few days. So, but this may not represent all the number of cases in the community, because we know that Omicron can be asymptomatic, and also the spread of the illness is related to the social distancing measures. So if we increase social activity, for example, people go out and gathering, and the number may rebound. So I would urge you to try to keep personal hygiene and social distancing.
Any other questions? The final one, this gentleman. I'm from TVB. I have a question. The representative of the National Health Commission commented that the epidemic situation in Hong Kong is now on a plateau, and it's just coming down in a staggeringly fashion. Do you agree with this observation? And what about the nursing personnel from the mainland? Are they now working in AWE? Have you received any feedback from patients? I agree with the expert's observation. We have 300 to 400 mainland experts coming to Hong Kong to help out at the Asia World Expo. They're helping our colleagues, so we regard them as colleagues as well. I understand that the majority of them have reported duty in the facility. They work in red zone with patients, and they also get their hands on taking care of patients and helping to treat patients. We hope they could help treat more patients. And previously, we had capacity constraints, but now we have more hospital beds and needy patients can receive the treatment. That's the end of today's briefing. Thank you.